Our patient number 2, is an aging 78-year-old man who came into the office with some concerns that are somewhat typical of the aging process. They included major memory loss, lack of emotional control, and problems recognizing people. These attributes are subsets of malfunction in key parts of the brain, such as the cerebral cortex, the frontal lobe, and the hippocampus. Upon investigation, we determined that he was suffering from Alzheimer's disease. These symptoms and affected areas of the brain matched up very closely with patients that had Alzheimer's, and hence we were able to diagnose him with this condition.
So now I'm going to explain it using the brain map. So since Alzheimer's destroys the neurons, a lot of the neurons have connections to the spinal cord or the brain. And so in this case, I'm going to talk about the brain and what it affects. So memory-wise, it affects the hippocampus, which is right here. And so that's going to, like I said, affect the memory. And then as Alzheimer's goes on, so the hippocampus kind of is affected more in the beginning of their diagnosis. So then as the diagnosis goes on, it'll affect areas like the cerebral cortex, which is responsible for like language, reasoning, emotions, like social behavior, and stuff like that.
The prognosis for Alzheimer's disease is that it gets worse over time, and it is ultimately fatal. People with Alzheimer's disease live on average of 4 to 8 years after the diagnosis. Some patients can live as long as 20 years after the diagnosis. The course of the disease varies from person to person. And for the treatment plan, there is no cure or plan for Alzheimer's, but there are medications for cognition and nursing homes available. Regular physical exercise can reduce your risk of developing Alzheimer's disease by up to 50%. Exercise can also slow further deterioration in those who have already started to develop cognitive problems.